Thank you, Chris and Alex, for being here and for talking about digital therapeutics and the evolving healthcare landscape. Chris and Alex are the co-founders of Mindset Health, and I'll let them briefly introduce themselves. So maybe Alex, you want to go first?
Thanks, Claire. Yeah. Hey, everybody. I'm Alex, the co-founder, co-CEO of Mindset Health. I was originally an accountant before I dived into my love of psychology, and I have celiac disease. So like gut health is very on the forefront of my mind. Thanks for having me.
Yeah. Chris?
Hey, everyone. Nice to have you all here. Similar to Alex, I studied mainly commerce and psychology during school. But before finishing sort of university, I dropped out to continue with Mindset Health. So early career was the start with Mindset Health, just pretty much due to a passion for psychology and wanting to increase the mind's influence in the world.
Awesome. We'll just jump right into it. Thank you both again for being here. Chris, you talk about your past and how your passion for helping people and passion for the mind's influence in health and how that's led you to where you are now. Can you tell me a little bit more about how your background led you to digital therapeutics?
Yes. So we originally didn't have digital therapeutics in mind when we started Mindset Health, or what was originally started as Better Mind, and then Mindset, and then Mindset Health. When we first started, part of my background was working on a different startup with Alex called Covet, which helped women rent different dresses. And I think one of our mentors asked us the question, do you want to work on this sort of problem for the next 10 years? And for us, that was a pretty easy answer, and it wasn't the problem that we were focused on. So we went back to our sort of roots and our core of what do we really care about? And it was psychology and the mind. And we originally started with trying to understand how we could influence the mind in many different ways. And we found hypnotherapy. So one of our dad tried hypnotherapy before and saw major success and kept pushing us towards it. And it had always been an influence in the power of the mind to us growing up. And so we used that as a way to dive into it. And originally we were skeptical because we didn't understand the research. And when we saw the research, we were like, this is a really interesting opportunity. We thought it was maybe towards the not effective side. And then after the research, it was quite effective and very clear that it's a good therapeutic approach. And so we decided, could we create a product that bridged that gap? And originally that was the Mindset app. So it's a sort of broad mental wellness app, but then we moved more towards digital therapeutics when we brought an IBS program within Mindset and saw major success. And then about 3 years ago, we launched Nerva, and that was our sort of first digital therapeutic approach.
So it's interesting how you didn't start wanting to go into digital therapeutics. It sort of evolved over time. Maybe Alex, you can, now that you are both leaders in the digital therapeutic world, maybe Alex, do you want to talk a little bit about what digital therapeutics even are and how you ended up being an expert in the area?
Yeah, happy to. So the way we think about digital therapeutics, and there's a lot of different definitions out there, but the way we think about it is evidence-based software that can help people manage or treat or prevent chronic or any sort of health condition. So I think the key parts to break out there is like, it's evidence-based. Like it is not a wellness app that has no, evidence behind it. There's clinical studies, there's research supporting its efficacy and its ability to help people. And then the other side of it is the software element. So it is like digital. It can be an app, it can be web-based, it can be other sort of interventions. But having an evidence-based approach delivered through a digital platform that helps people manage their health, that's how we view digital therapeutics.
Awesome. Maybe you can speak. We're going to dive in later in the interview and talk specifically about the Nerva app as a case study. But maybe Alex, you can talk a little bit about how digital therapeutics sort of fit into the overall healthcare landscape. And what benefits digital therapeutics offer over traditional healthcare approaches.
Yeah, happy to. So the way we think about like digital therapeutics is that essentially what they're doing is combining the best of what makes therapy really effective and what makes like medicine and drugs really effective. So that's, therapy can produce amazing outcomes and help a lot of people, but because it is delivered by human therapists, it is inaccessible often. It's not standardized. It could be disparate based on the therapist you're speaking to or the practitioner you're interacting with. And on the flip side, Medicine, what it's really good at is like it's standardized, it's scalable, it can be used across the world very easily, and it is much more accessible than, say, therapy. And so what digital therapeutics can do is take the best of that sort of accessibility, that standardization, that scalability that drugs offer, and combine that with the best of what the best therapeutic approaches can offer. And that's sort of like the main thing that digital therapeutics are different and like offer the world, is that it makes really good, strong evidence-based therapy accessible to the masses and accessible to people. And for us, the way we think about it is that it also makes it helps patients like be empowered to manage their own health. So whereas, and that often can happen in therapy or even medication, but the key part of this is now this is accessible to yourself. You are empowered to manage your health yourself. You can learn those steps. You can self-direct your care, whether you're working with a practitioner or not, alongside that digital therapeutic. And I think that's where it sort of sits, in that there are a lot of conditions where drugs are ineffective or not the best solution. And there's a lot of areas where therapy is really effective, but inaccessible. Where digital therapeutics sits in that wide healthcare landscape is that it can sit where, when therapy is inaccessible and drugs don't work or aren't necessarily what should be the first line option, that's where they can sit as like a management opportunity or self-directed care or alongside a complementary service when you're working with a practitioner.
One thing you just touched on is how digital therapeutics are great at delivering standardized care to lots of people around the world. Maybe Chris, you can talk a little bit about the difference between in-person therapy, which can obviously be tailored to the individual, versus therapy that's delivered via a mobile app or a digital therapeutic, which is standardized.
Yes. So originally, when we were starting out trying to find out what type of program to go into, there's a lot of research and validation behind specific protocols. So specific standardized approaches that you take generally with in-person therapy, and a patient will sort of go through that pathway. And by the end, you can expect a certain outcome because it's a very predictable protocol. Generally, that's not what happens with in-person therapy. With in-person therapy, you have that ability to tailor and adapt it to a person's needs. Not everyone will respond exactly the same to the same type of session and the same type of protocol. And so that adaptive approach is something that is a very unique advantage that comes with in-person therapy. I do think the gap is bridging, though, with digital therapeutics. So with digital therapeutics, because we get access to the patient themselves, and it is still a one-on-one interaction, even if it's standardized and scalable. What we do have with digital therapeutics is the ability to tailor certain things. So for example, within the Nerva app, if you like certain sessions, by the end of the program, you'll get automatically showed those sessions more often. And so that's an example of something where it's like we're listening to the person, we're understanding, but receiving their data, and then we're personalizing or changing the standardized approach where necessary. Generally, though, digital therapeutics have restrictions in terms of the depth that they can get into in that point. So for example, some therapeutic direction or outcomes will be very hard for us to get to because we can't get personalized into the person's history as often. And we often rely on either the data that they give us or the data that of the actual use of the product itself. So generally, we come from that sort of standardized baseline and then see where we can add personalization to get closer to that in-person therapy experience. But the level of depth that comes with in-person therapy is way beyond us right now.
Yeah, I can imagine, because my background is in research. I can imagine that it's similar to clinical trials. When you run a clinical trial, the protocol is always standardized. And so it makes sense that you could make the jump from standardized protocol in clinical trial to a standardized protocol delivered via a digital therapeutic. And it's cool to see Mindset Health doing that. Chris, maybe you can address this and just how does Mindset Health, but how do digital therapeutic companies in general approach the development and validation of products? And what kind of evidence do you rely on to show the efficacy of the product?
Yes, I think at a baseline, what we sort of look for is an in-person protocol that we can leverage as a way to get a baseline of research high. So for example, with Nerva, we worked with Dr. Simone Peters and her 2016 RCT comparing the low FODMAP diet with Nerva or with gut-directed hypnotherapy program. And with EVS, our menopause product, we worked with Dr. Gary Elkins, who ran a large study in the US comparing hypnotherapy for hot flashes versus some attention for hot flashes. And so what we've done is we worked with that sort of core baseline as a way to then, when we do transition that in-person protocol to a mobile app, we have that baseline of evidence because it's so important to us. And then what we have is the ability to track sort of every person who goes to a product in a aggregated and research focused way, where we can see that, we've had over 100,000 people go through our product. And to date, we've run over 8 retrospective studies or running over 8 retrospective studies into different healthcare areas. For example, we ran one generally looking at how does the Nerva app perform, and we see that it performs nearly as good as in-person therapy for the same approach. We also ran one comparing people that worked alongside a healthcare practitioner or that were referred by a healthcare practitioner versus those who weren't. And we saw that those who were referred saw better adherence and better compliance, leading to better results as well. So those sort of ongoing retrospective studies is a key thing for us to be able to not only show that we can be effective and show that we can be very effective, but also see what is effective and sort of slightly change the program to adjust to that. So that's another side benefit of digital therapeutics is we do get those feedback loops. So because we have this sort of large data set and large amount of people going through the product, we can understand that maybe this session is more effective, so we should show this session more or anything like that. And we're also running randomized controlled trials. So we think about it in many ways. So there's sort of smaller studies that can help us understand specific points, as well as the larger, bigger randomized controlled trials, which are running with Monash University right now.
I can imagine one of the benefits for digital therapeutics is having a large amount of data with increased access to patients. You have increased access to data to run clinical trials and run studies, retrospective studies. Alex, maybe you can talk a little bit about concerns healthcare providers might have around data privacy for patients with these large data sets.
Yeah, happy to. The way we think about it is that because we are like acting as that sort of software platform, we have a duty to protect their data, and we ensure that we work towards making sure that the platform itself is built on best practice. So it's not only like, okay, as a general wellness product, which it definitely partially is, but how can we ensure that the data we're collecting is used in the right ways, that we are letting users know how we're going to use that data, and then we're working towards ensuring that we comply with the certain things. So if in the future we want to share data with practitioners, it'll be important for us to be HIPAA compliant. And so there's several different frameworks that software providers and digital therapeutics companies can actually use to ensure that they're protecting user data. And it is a big focus for us because, to your point, we do collect a lot of data, and that data enables us to run incredible studies and build that evidence base, but to improve the product over time. That feedback loop that Chris was talking about means that the product gets better over time instead of being like a static thing. And so we need to safeguard that. But one of our big cultural values is that we care about the user. And I think fundamentally caring about the user is caring about their privacy, about their data, and taking the steps that we can do to protect it as best as possible.
And Alex, I'll ask a follow-up question to that is, how can healthcare providers, if you're looking at all the digital therapeutics that are out there and available to your patients, how can healthcare providers decide A, which ones are trustworthy, and B, which ones are really going to care about the user and protect healthcare data?
There is a emerging association. So the Digital Therapeutics Alliance is a good place to start. And that sort of cuts through some of the noise. Like there is, to your point, like hundreds or thousands of wellness products, and it can be confusing. So I think that the way we would think about it is like, okay, do they have a base of evidence? Are they taking research seriously? Are they conducting their own studies? Like even if like a company or a product is doing that, they're in the top 1% of digital apps or health apps out there. And so having that focus on building evidence separates most companies from the real digital therapeutics companies that either sit on Digital Therapeutics Alliance or are conducting their own research. So I think starting from there, and then you would hope based on researching their website, understanding the communication, speaking to them, you can have a better understanding of what are the things that they care about, what are they optimizing for, and what are the safeguards that they have in place to protect users, to protect their data, and to protect the relationship between the practitioner and their patient.
And I think once you've sort of got that research base to separate the digital therapeutics from other products that might not be able to be as evidence-based, one way that you can sort of see if someone cares, if a company cares about their users, is you can see how much the patients enjoy using the product. one key thing there is to create a product that patients enjoy, you have to really understand them. You have to care about them. You have to listen to them. You have to sit there deeply thinking about the best way to add in this new feature to the product or the best way to improve the content. If patients care about a product, you can likely trust that the company cares about the patients. And so I would respond based on how's your users feeling? Do they enjoy using the product? Is there sort of key things there? It's a good indication of if it's a thing worth trusting.
So a lot of what it takes to see if a digital therapeutic company is trustworthy is doing the research on your own, looking at their evidence base, talking to users that have used the products. And I can imagine that is a barrier for healthcare providers to adopt and refer digital therapeutics to their patients. Chris, can you speak about what other barriers there are for healthcare providers to adopt digital therapeutics in their practice?
So I think as any sort of emerging approach, it is a bit unknown about how you adopt it or how you take it into your practice. And I think that's its own learning experience that comes with time. I think in 5 years' time, it'll be a very normal thing to do in terms of using a digital approach like this for specific healthcare conditions and integrating within a certain plan. But one of the sort of key ways you can learn is by, one of the key barriers is that understanding where it fits in within your plan is really hard. Even understanding how to refer it. Some products you can just say download the app. Some products you'll have to understand that you need a prescription code or a code that you can have to refer them through for them to be able to use it. It's all a bit confusing and can be confusing. It's a big focus for us at Mindset is how do we make this as simple as possible. We have onboarding calls with practitioners to be able to walk them through the process and answer any questions. And we're pretty much always here if there's any questions at all. So if there is, just reach out to Claire at Mindset. She'll be able to help you, mindsethealth.com. But generally, some other barriers are understanding how patients feel about it in terms of costs associated with it and areas like that. So generally, digital therapeutics can be more expensive than if you're looking at a normal app, so a $2 app on the phone, and that can feel drastic. But when you compare it to other approaches that have similar outcomes, it's actually really cheap. Or if look at comparing it to one single session of in-person therapy, you see it cheaper than that. So it's that sort of mental barrier to get over. What is an app versus what is a therapeutic approach that can have real outcomes for the patient?
Maybe, Alex, would you mind touching on how digital therapeutics can be incorporated in a healthcare provider's practice without digital therapeutics sort of taking over the practice of the healthcare provider?
Yeah, happy to. So it definitely depends on the type of practitioner and depends on how you like to work with your patients. And I think that's touching on what Chris is saying. Like a lot of the work we do is educating and working with practitioners to help them understand this is what the product is, this is how it works, this is how it could work with your patients, this is the type of patients that might best benefit from this, and this is how to answer their questions and communicate that. And once they're really confident around that stuff, it's incredibly easy to refer. But to that point, it is dependent on your type of practice. So a lot of dietitians, for example, work with Nerva as a complementary for patients who maybe have anxiety or depression as a trigger or stress as a trigger. A lot of them also just work it as a complement that alongside their dietary approach, because it does show that it can work to enhance the benefits of, low FODMAP diet or things like that. And on the flip side, if you're a GP or a gastroenterologist, you're really looking to find a way to help your patient as best as you can with the limited time that you have. And you may not know a GI psychologist, you may not know someone you can refer this to. And the way you would operate there is, this is a product that, it's low risk to try, give it a shot, see if it works. And if it doesn't, we'll come back and we can figure out something else. So it's solving different problems, and it would be integrated differently based on the type of practitioner you are and how you like to operate with your clients or your patients. And we do a lot of work. And if you go to our website and download our clinician pack, we do have a lot of educational resources to help guide you through that process of what is right for you and your clients and your patients, and how could you best integrate that.
And I think specifically with dietitians, a big part of our approach is that we want to sort of own what they're good at, which is introducing the mind into different healthcare conditions such as IBS. But we don't see ourselves playing that bigger role in terms of, we know IBS is a complex condition. We know that there's many different elements to it, and it's important that a general integrative approach is taken when something like that is with a complex condition. So we also sort of structured the program as well as some of our resources around how do you manage that patient over time. So things like we often ask for review appointments. So maybe you have a review appointment halfway through the program and at the end of the program. And we've got the clinician guide where you can sort of read that and understand how they might be feeling at week 3, how they might be feeling at week 6. We also send physical letters to, which include some of the symptom data with patient consent to your practice if the patient chooses to inform you, to keep you in that loop of how they're going. So it means that you can sort of personalize their care as a result of their Nerva usage as well.
We've sort of transitioned there naturally, but I think now it's a great time to switch over to talking about Nerva specifically as a case study in digital therapeutics. And it's obviously hard to tease out Nerva from digital therapeutics when talking to the co-founders of Mindset Health. But maybe Alex, you can talk a little bit about how you became interested in gut-directed hypnotherapy and how gut-directed hypnotherapy was a good model for a digital therapeutic.
Yep, happy to. We came across gut-directed hypnotherapy because of our relationship with Monash University. So Chris and I attended Monash University, and they developed the low FODMAP diet. So they're a really strong leading research university into IBS. And that's where Dr. Simone Peters ran her randomized control trial, where she compared the low FODMAP diet to gut-directed hypnotherapy. And we thought that was really interesting. And at the time we were working with Dr. Michael Yapko, and still working with him now for our next product as well. And we were like, oh, this seems like a great product or a great program that we could bring in and integrate with our general wellness product as well. And what we discovered was, the users who were going through Nerva and going through at least the precursor to Nerva were significantly more likely to retain than in like a general wellness setting. They're dealing with a chronic condition. They were underserved by the sort of approaches that they've been able to access today. And what that meant was they were sticking around a long time and they were seeing really good results. And so we realized that there is a huge amount of clinical and controlled evidence supporting gut-directed hypnotherapy for IBS. And it's one of those conditions where it is complex. A lot of people are struggling to manage their condition. And we realized that there is a big opportunity for us to really double down on this and double down on what was working and build this digital therapeutic. What's really exceptional about gut-directed hypnotherapy and hypnotherapy in general to be a digital therapeutic is that the way it is delivered in person can be easily, or more easily than other types of therapy, replicated in an app, because you often will shut your eyes, you listen to someone speak. You can similarly reflect that by shutting your eyes and listening to someone speak in the app itself. Obviously, there's differences in how we can personalize it and things like that, but the way that gut-directed hypnotherapy and Dr. Peters' research, it was very standardized. It had to be for that research setting, and it meant it was very easy for us to then transfer that and deliver it through a mobile app.
Other than the standardization and the ability to standardize hypnotherapy, is there other reasons, Chris, why hypnotherapy was a good choice for a digital therapeutic?
Yes, so hypnotherapy is all centered around empowerment. So for those that know hypnosis itself isn't a therapy. It amplifies other therapies. So within the hypnosis session, within Nerva, we have guided imagery and direct suggestion, which allows someone to sort of see the results themselves. But hypnosis is all about focused attention and absorption that allows that person to get really absorbed in the content and then feel empowered. So one of the just core reasons is that it's really effective and was one of the most effective solutions for gut-directed hypnotherapy. And that focused attention absorption allows for the mind-body connection to take place. And so a big core part of that is when you compare something like cognitive behavioral therapy, which is also shown to be effective for IBS, we see it works in many different ways in terms of for specific people that respond with stress or anxiety. But with Nerva and gut-directed hypnotherapy, we see that it responds across the board, regardless of if someone has an anxiety and stress link, which is a great sort of general outcome. And so that mind-body connection enables us to sort of use the mind in many different ways. But within that hypnosis, we can have different therapeutic suggestions. So we're likely going to do a mood product in the next sort of 6 months. And within that mood product, we'll take a more cognitive behavioral approach because that's what's shown to be most effective for anxiety and depression. And so we can generally take what's the most effective sort of therapeutic approach wrapped into this really enjoyable. And maybe that's the other sort of area is that it's enjoyable. patients enjoy the sessions. If you've referred or if you know any patients that have gone through Nerva, it's a very relaxing experience. It can be a sort of general wellness habit. Even after people have sort of seen results, let's say 6 months down the line, they might still be listening every day because they just love the wellness habit. And so that actual just enjoyable nature of the therapy is a really important part when the person is by themselves doing it at home.
And Chris, I'll follow up on that, it sounds like hypnotherapy is an excellent tool for a digital therapeutic. Can you talk a little bit about the limitations of it, and specifically about the limitations of gut-directed hypnotherapy being delivered via mobile app?
Yeah, so general limitations is this will help with everything. This is a catch-all for any type of condition. There is only certain conditions where there's been evidence to show it works. So other things such as chronic pain has been shown to be effective. Smoking cessation, we've recently launched a product called Finito for smoking cessation. And so within those realms of conditions where it's shown to be effective, it's a really good option to be able to provide to patients and to create a digital therapeutic around. But if we were trying to do it for a condition where there isn't evidence-based, then there is barriers and limitations there around what we should be doing. And in terms of gut-directed hypnotherapy, I think it does come down to that general inability to be personalized for these specific sessions. So we are working towards becoming more and more personalized over time, but currently, compared to in-person hypnotherapy where you could be more personalized, it can't be there. Also even within the Nerva app, we provide different modalities apart from just pure sort of gut-directed hypnotherapy. We have psychoeducation readings and breathing techniques. So one of the limitations of gut-directed hypnotherapy, it's like a 15, 20-minute session. If it's a 15, 20-minute session, it might not fit into your life for every single thing. And so that's why we teach something like diaphragmatic breathing, which is a good sort of exercise that you can do at any point during, you're walking home from work, or like with hypnotherapy, for example, if you're driving your car, you can't do the session. If you're doing anything that requires your attention, you can't do the session. So some of the limitations in when and where you can do it, because you need to be in that sort of focused state.
There's also like a couple of other limitations in that it's not suitable for everyone. Like people who have certain like mental health disorders, it's not right for, so psychosis or other similar conditions. It's also like compared to seeing like a clinician in person, like Nerva isn't a treatment. It doesn't replace your traditional like approaches. It is a self-management solution. And so that still may not be right for everybody. Like it is an amazing tool and empowers people to manage their health, but it isn't a treatment. It doesn't replace, going to an in-person therapist or in-person GI psychologist or anything like that.
I have a question here that Alex, you might be able to touch on. One healthcare provider says that she refers Nerva often, but she's wondering why she can't see patient progress in real time. So why on the back end you can't see exactly what the patient is doing in real time?
Yeah, so we do have a platform called Connect. And so Connect is the platform that we think in 5 years' time will be the sort of perfect solution for real-time monitoring. The real answer is we have a Connect right now. Currently, you can see real-time sort of where the patient is in the program, but you can't see symptom reduction or certain other data principles. And that's because Connect isn't sort of built in a way that supports that in the level of privacy and security that we enable. And we haven't built the way for the patient to give the consent needed for that. So we're actually in the process of this year building that out. So that could become this real-time sort of platform to be able to see symptom reduction when a patient enters it, to get notifications if they drop off, to really sort of create this platform where you can use the data as a way to engage with the patient and create that relationship. Currently, what we do have is you can see their sort of adherence data, and you can see if they're listening or if they're progressing through the program. And you can also see the symptoms at the start and the end, but not real-time data in between at the moment.
Awesome. Maybe Alex, you can touch on, we've talked sort of roundabout about Nerva, but maybe you can talk about some of the outcomes for patients and what patients typically see when going through the Nerva app.
Yeah. So Nerva is a 6-week, it's a two-part of the program. So initially there's a 6-week gut-directed hypnotherapy program that involves listening to 15-minute audio recordings based on Dr. Peters' research at Monash University, as well as psychoeducation that helps them understand their condition, understand the mind-body connection, set the correct expectations, as well as breathing exercises that can help them manage their nervous system. And throughout that program, they learn skills that enable them to essentially manage their condition and turn down their perception of the false alarms from their gut and address this miscommunication between their gut and brain that can trigger IBS symptoms. And what we see in the research, and we haven't completed our randomized controlled trial, but in the in-person research and in our retrospective studies, that there is around 89% of people report any level of improvement in their ability to manage their symptoms, and 63% of people report a clinically meaningful improvement in their symptom management. So strong results showing there that we're like very similar to work as well as in-person studies. But we're still waiting on our randomized controlled trial to be able to like confirm that, where we are testing Nerva as it is today compared to a version of Nerva without the gut-directed hypnotherapy component.
And Chris, can you talk a little bit about some of the peripheral benefits seen with the Nerva program?
Yeah, so within the Nerva app itself, what we do have is also symptom tracking throughout the program. So we have, we track the VAS-IBS, so scales of abdominal pain, constipation, abdominal pain, nausea, stool consistency, as well as the PHQ-4, so an anxiety and depression scale. What we generally see as peripheral benefits through Nerva and most mind-body therapy approaches is a reduction in anxiety or depression, as well as an increase in calmness and relaxation. And so that general sort of ability to become more calm and regulate your sort of response to anxiety and depression both improve, which is great to see. And that's why specifically we mentioned some of the patients that if you're looking to find a patient to start off with, a patient with a link with either anxiety, depression, or anxiety and stress is a good patient to start with, because not only will they receive the sort of GI symptom benefits, but they'll also receive, or they can receive those, or they can also receive the psychological benefits as well associated with the program.
I'll open this up to either one of you who wants to take it. But how is Nerva and how is Mindset Health working with healthcare providers to ensure that healthcare providers A, know enough about the program and know enough about hypnotherapy, but B, feel supported that they can speak to their patients about this?
So I think our general approach is similar to how we approach why we built Nerva, and it's all around empowerment. So with Nerva, we built this sort of education therapy experience where people can sort of become empowered to self-manage their condition. We've taken that same approach with how we work with practitioners in terms of how do we empower them to be the expert? How do we empower them to own that relationship? How do we empower them to embrace Nerva as a part of their practice? And generally, some of the ways that we do that is we have ongoing one-on-one relationships with practitioners. So normally that starts out with an onboarding call. So an onboarding call will help you walk through the general sort of overview of the Nerva program, an understanding of some patients that might be a good fit, and things like how to refer. And then what we do is have sort of regular catch-ups. Then maybe it's every 6 weeks to be able to, or maybe 2 months to be able to talk through how it's going. Is there anything we can do to help? Is there any type of resource we can build? And that's the other sort of general thing that we've done is we've built a lot of resources, which can be things like we have referral pads where you can rip off a script and refer to your patients. We've got patient overviews you can hand out. We've got clinician guide, which sort of talk through what a patient will feel at certain points. So we have these resources that help you sort of bring it as a part of your ecosystem, as well as generally educate and empower, as well as things like this call now. Hopefully it creates a dialogue between us and you, and we can sort of start talking a bit more about, generally any sort of questions you have as well. And so these type of content and resources, as well as that one-on-one relationship, is sort of generally how we think of it.
Yeah, one of the criticisms of digital therapeutics and app-based therapeutics is obviously the sort of lack of access for healthcare providers to see what's going on when their patients are going through the program. And you spoke to it a little bit there in your answer, Chris, but maybe Alex, you can talk about how Nerva and how Mindset Health's products are trying to break down that barrier, that black box of that miscommunication between app-based care and what healthcare providers can see.
I think the approach that we're taking is very different than a lot of like telemedicine practice, for example, where they aim to sort of like cut out the practitioner from that approach, from that plan with the patient. We take the inverse approach. We think that it's incredibly valuable, the relationship that a user or a patient has with their practitioner. And we want to work within that framework to be integrated into their practice, as Chris was mentioning. And as part of that, educating through all these resources is a huge part of it. And that's a key way of like, you can be confident that this sort of program, like how to answer questions around this product, and you can be confident of guiding them through that and providing it to the right patients. But the best way really is to go through it yourself. And so we do provide every practitioner who, joins or contacts us or downloads the clinician pack can access Nerva or any of our other products for free. And go through it themselves. Obviously, that could take some time, but it can be fully unlocked. You can sort of experience it from from a patient's perspective firsthand, as well as from a healthcare practitioner's perspective. And I think that approach of like, we provide all these resources, and you can, if you have the time or the inclination, you can access the product yourself and really understand it, what they will go through, enables the practitioner to have that deep relationship with their patient and integrate us effectively, or integrate our products effectively in a way that helps the patients the best.
That's awesome. Can you speak about, I'll open this up to both of you. Can you speak a little bit about the future for mindset health and how mindset health fits into this evolving landscape of digital therapeutics in healthcare?
Our mission and our vision is to help 1 billion people manage their health without requiring drugs, essentially. We don't think, we're not anti-drugs. Medication is amazing. But what we think is there's a huge opportunity for many people across different indications to work with their practitioner, to leverage the skills and the ability of their brain to improve their pain perception and change their immune system, and all these benefits that have been shown that your brain can do. We want to unleash and unlock this potential for them to manage their health with their mind. And the way we think that is best done is by building this suite of hypnosis-based digital therapeutics that are based on evidence, that integrate within healthcare practitioners' practice, that really provide the outcomes and the engagement and someone asked about gamification, the sort of enjoyment that patients need to stick around and learn those skills and learn how to unleash this potential. And so in the future, that looks like launching a mood product, launching a product for chronic pain, launching a digital therapeutic for sleep, for other conditions. Because not only are these like massive, unresolved chronic conditions in their own right, but because of the high levels of comorbidity amongst these patient populations, we can actually help patients across different of their conditions. We've gone through Nerva, you've managed your condition, you're feeling great, you're feeling much more in control, and you've built a positive relationship with your gut. But now we know a significant percentage of people with IBS have an anxiety, stress, or depression comorbidity. How can we help you with that condition as well? And still be part of that framework with the practitioner, but extend the ability of that practitioner and that patient to manage their health.
I think adding on top of that, in sort of, let's say 5 years' time, we talked about it before, but it'll become normal to refer and manage conditions through a digital therapeutic. It'll become normal for the practitioner to have data on the patient going through certain things. It'll become expected that each product has direct results and research behind every product, and on an ongoing basis, that's sort of changed over time and can be continued to be improved. So if you think about a couple of things there, the other thing I would mention is around integrating deeper and deeper into the healthcare system. So things like we talked a bit about before around creating that real-time dashboard that allows you to sort of see the data on your patient, but that could even potentially evolve into a platform where you can engage with your patient and you can sort of potentially even personalize the therapeutic plan within Nerva as a result of, that this person has this tendency to talk about food this way. So let's put in an educational article that talks about food in a certain way. So that's sort of increasing personalization tied with deeper healthcare integration. And in 5 years' time, we'll also be covered by insurance all across the world, hopefully, and be a sort of key part of the healthcare network in the same way that drugs or supplements are. Will be another option there that's sort of very research backed, and or digital therapeutics will be.
What responsibility do you both feel as co-founders of one of the leading digital therapeutic companies? What responsibility do you feel to develop really gold standards of how we're developing digital therapeutics, interacting with the healthcare system, interacting with healthcare providers, and serving our users?
I think when you're working with patients and working with users to help them manage conditions, you have a responsibility to have their best in mind. So building the evidence to show this actually works, like, I think is fundamental. Like, people are purchasing this, they're spending their time, they're really excited for the results that they're hoping to achieve. And we need to have evidence and, support that we can actually offer that to their patients. And similarly, thinking about from a patient first perspective, we need to ensure that we are taking into their practitioner in mind and keeping them informed, because that's what's best for them. And then understanding that, data and data privacy, again, is coming down to that patient first approach, where of course patients want to ensure that, like, I want to use this product, but I don't want to be at risk of my data getting lost or, X, Y, or Z, or used inappropriately. So I think because we are approaching it with a very patient first mindset, we are responsible and are deeply focused on ensuring that what is best for the patient permeates through our entire company. And at least I think Chris and I both agree that is a core part of what we're trying to do here at Mindset Health.
Awesome. Chris, can you talk a little bit about the next 5 to 10 years of digital therapeutics and what you see as a founder in this area, some of the trends are, and where this industry is going?
Yes, I think the next couple of years would sit predominantly in the realm of still trying to sort of prove out that digital therapeutics play a big role within certain conditions in the healthcare market. I think generally the conditions will be where there's already evidence behind in-person therapy, especially if there's a standardized protocol behind it. And that'll be the sort of first type of programs that come out. So if you look at other programs in the US or in Australia, generally people have done conditions where it's already shown that there's evidence behind it as a therapeutic approach. It is still unknown. There is, in the US, there's prescription digital therapeutics. So they're digital therapeutics that have to be prescribed by a doctor. That is an approach and allows you to go into different healthcare conditions. If we look in 5 to 10 years time, there are certain healthcare conditions which should be prescription. So let's say a schizophrenia product, for example, in 5 years time, that should be prescribed in the same way that a drug is prescribed, potentially even as an alternative. And we don't know how that sort of looks, but in 5 years time, we'll start moving more and more towards these higher risk conditions which require more depth of regulation and understanding of what sort of claims and ways you can talk about the product can be. So if we look in next couple of years, it's really centered around getting our feet, getting our sort of playing our role within the healthcare system, integrating more and more, working within these sort of lower risk conditions that, so for example, with IBS and Nerva, partnering with a practitioner who's sort of already validated that this could be a good approach. Gut-directed therapy is extremely low risk as an option. There is generally no negative side effects, and unless you're sort of one of the specific audiences that should not be referred to gut-directed therapy, but generally very low risk. And so paired with a low risk condition is a really good option to start moving more towards creating these really effective digital therapeutics. And then in sort of 5 to 10 years time, we'll start seeing a lot more of these complex conditions that we don't understand, even if it'll work at all. And we'll be running, and everyone in the world will be running research, trying to find the new drug, and the new drug will be a new digital therapeutic into a complex condition, which we don't know. Alex mentioned the immune system before. There is research to show that the mind can affect the immune system. Where that can be used and utilized in the future, we have no idea. And that's pretty exciting to be on that sort of forefront, and being that you can sort of challenge the way that we're managing these complex healthcare conditions. And of course, it'll take a lot more time to get those conditions to a stage where we're comfortable launching a product with those. But in 5 to 10 years time, we'll start seeing more and more of these really complex ones, integrating really deep with the healthcare system, reimbursed by all insurers because it's so effective and cost effective.
Can you talk a little bit about, you mentioned there briefly about being prescription-based versus direct-to-consumer. Can you talk a little bit about why Mindset Health chose to be direct-to-consumer versus pursue prescription-based?
I think
For sure.
a big part of coming back to that sort of mission for us, which is to empower 1 billion people, and that increased access is a core of what we're trying to do, and increased access is a core of how we can empower 1 billion people. And for us, working within a low risk condition, which we can be direct to consumer for with a low risk option, we made the choice to stay or stick within direct to consumer, as that enables the increased access that we were looking for. If we were doing as mentioned before, a high risk condition, that would change. But with a low risk condition, low risk area, with us optimizing for patient outcomes, where direct to consumer makes most sense. Direct to consumer also enables a lot of things like that data feedback loop. So we have, let's say 250 people come through the program a day, and all that sort of allows us to create a better and better product over time, which keeps that consumer or that patient at heart, which again is core to our company. So yeah, Alex, do you have any more?
I would also say it unlocks the ability for allied health professionals to integrate digital therapeutics into their practice. So if you do go prescription only, it limits that to GPs or PCPs or gastroenterologists. But we do know a lot of people with IBS are working with dietitians, nutritionists, naturopaths, other psychologists, other allied health professionals that we think are an incredibly valuable part of that integrative approach. And by staying in this sort of digital direct to consumer, not only is it more accessible for the patients, but it's more accessible for the practitioners that are working with those patients.
Just to wrap up, I think we're close to the end here, but as a final question, I'll pose it to both of you. For healthcare providers who are looking at this evolving landscape of digital therapeutics, what are some of the things to look out for? We talked a little bit about how to determine which therapeutics are trustworthy, but what are some of the red flags in the industry, and what are some of the things that are that they should look for as great signs for digital therapeutic companies?
I think an easy way to see a red flag is to go to the App Store and see the reviews. If the reviews are less than less than 4, we know that it's a red flag, depending on if it's App Store or Google. But if it's the App Store, the Apple App Store, and it's less than 4, it's quite a red flag that it's not a strong product that patients will love. And I think that's such an important part of digital therapeutics. So I'd consider it a red flag.
Also, who are they working with? What are the experts? Who is their scientific advisory board? What are the partners? For us, it's Monash University and other universities. Who are their investors? Are they backed by reputable firms? Understanding who was supporting them and who was working with them. We work with American College of Gastroenterology and things like that. That's an easy way to use social proof to you may not know that company, but these partners. Therefore, you're sort of understanding that quality transference. And then, of course, the evidence side of it. If they've done studies, they've it's fundamental to think about being evidence-based as a digital therapeutic. And if that is not a focus clearly by the work that they're doing, then that is a red flag.
And I think another one would be if you ever contact them, the experience that you have. I think I'd hope that if you contacted us, you'd have a great experience, would help you in every regard. So if that's not the case, please let us know, and we'll work as much as we can to improve that. But generally what you'll find is if you contact a company coming from where you're coming from and you're not treated very well or helped out or in an empathetic way that's sort of informative, then they might not be a company that cares as much as they need to. And so that could generally be a red flag as well.
Obviously, one of the things about digital therapeutics that's different for healthcare providers is when you're referring a pharmaceutical product, the FDA has given their stamp, in the US at least, the FDA has given their stamp of approval on that pharmaceutical product. And that's sort of how and how you can trust. One of the things about digital therapeutics that's different is having to do your own investigation and research. And I think all those things that you mentioned are really helpful for healthcare providers and where to look and where to look for red flags, where to look for the green lights of a digital therapeutic product being high quality for their patients. This has been really helpful. I think our healthcare providers are gonna love this, and it's been amazing to hear you both talk about developing Nerva and developing Mindset Health into the industry leader that it is. Thank you both so much for your time. And any final thoughts before we wrap up?
I think there is a question from Manuel that we can answer.
Yeah, there is. Thank you for that. What do you guys think about the power of behavioral change and psychoeducation by gamification in digital therapies?
It feels like there's a couple of things there, but just touching on the gamification side, like gamification is a bit of a buzzword and can mean a lot of different things. But the way at least I think about it is, how can we make the product as engaging as possible? Like, we know that, habits are important. We know that rewards are important. We know that making a product enjoyable is important. And I think one of the other benefits of going, this direct to consumer route is that is a very, at the forefront of our mind, in that, it is very easy to start one of these products and drop off. And that happens often with several types of digital therapeutics and several types of approaches in general. And gamification is one of the tools that you can use to make it a more engaging experience that you as a user want to stick around to. And that's how I think about it. It's not the outcome, but it's a way to when we think about outcomes, from a health side, the outcomes are driven by, the efficacy of the actual approach, but also how engaged they are, how accountable they are. And I think the gamification is really important on that side of that, or at least a powerful tool to drive engagement, drive accountability, and drive them to actually complete the program.
Awesome. Any final thoughts from you, Chris?
I don't think so. I think it is still unknown in the world how digital therapeutics will play out. And I think that's exciting. I think we can all play a role in how that happens. Obviously, from our end, we're working on the products themselves, but from your end, you're testing or utilizing the products and seeing how it best fits in with your workflow. And I think it's all a learning experience for us. So in the same way that if we learn something, we'll share it with you. If you learn something about how it works, fits into your workflow and how it works best, please share it with us. We're very, very, very keen to sort of get involved and create the future of health together.
Awesome. Thank you both so much. The recording of this will be sent out to all the registrants who were not here. And if you were here, then it will also be sent to you. Again, thank you, Chris and Alex, so much for your time. I appreciate it. And we will be back next month with another webinar. So check your email for the description and the registration for that.